Hello. This time I would like to talk about medical marijuana again. Basically, there were two news stories this week alone about medical marijuana, and both of them were not very good. One of them was that a worker can be fired for using medical marijuana, even if they're not using it on the job. And another is that um, on Yahoo News reports also that a mother is facing losing her son secondary to using medical marijuana. So, first off, what I want to say is I actually don't believe that medical marijuana actually works for pain. The data is poor. The best data that we have shows that it does work, but only in specific types of pain, such as HIV neuropathy, multiple sclerosis, and cancer pain. So, having said that, the need for medical marijuana is low. However, if we're going to prescribe it and we are going to allow people to use it, then we need to create laws that are much more realistic. And one of the problems that I have when I hear about these stories is that we are passing judgments on these people when even the government has no idea what to do with medical marijuana. You have federal laws, which are very different from state laws, and in certain cases, and you have the two government bodies fighting each other. You have the DEA rating people and then not rating others, and it's sort of the Wild West right now. Um, and that's problematic because it puts patients in limbo. So, what I personally believe is that if we are in limbo, we should not be overly harsh on people. And that is why, personally, in my practice, I don't even test for marijuana in the drug screen for patients because my opinion is that if the federal government and the state government can't figure out exactly what to do with it, who am I to judge a patient for using marijuana for medicinal purposes, whether or not they were prescribed to that person? So until the laws are clear, I don't think anyone should be fired or suffer any major retaliatory action until the situation is cleared up. Once the government has made a final decision on marijuana, then we can go ahead and enact policies in regards to how people can or cannot use marijuana. Just my opinion.